Hello everyone. Today I'll be going through how the principles and methods of quality improvement science was used to improve communication in a local GP practice. While working in your organization, you may notice how things are done, and you may often wonder, is there a better way? Curiosity, frustration, confusion are the few emotions that lead to improvement. In this example, a staff at the GP practice had found the directory information in their instant messaging IT software very confusing. It also meant that it had limited use for communicating with colleagues. So he felt that if the IM system worked properly, it should reduce interruptions in the consultation and the usual knock-knock on the door of a colleague. You're right. He had the will to change things, and he did. He decided to gather the baseline data to see if others felt the same way. He made assumptions that people will have similar experiences like him, and using that, he crafted an aim statement and family of measures to guide his project. You can use the link below to watch my other video on crafting aims. A visual representation of his hypothesis of change and planned activities is shown using what is called a driver diagram. Look at the diagram. He hoped that to achieve 50% increase in a favorable response to the clarity of information, he needed to make them aware of the total instant messaging interface and the functionality it had, as well as having the right data on the directory. His planned activities included using an email to send out survey and updating the directory with the right data and clear format. When doing a QIP, you need to know who your influencers and distractors are and create a plan to work with each agency to make your project successful. In his case, the staff were more than willing to participate in his project. Surveys were completed and returned in record time. I usually recommend you use MS Excel spreadsheet to collect your data from the get-go. In QIP, we use the Plan, Do, Study, Act cycle to go through iterations of a change process. If you don't meet your target, you go back and start the cycle again till you reach your goal. Fortunately for this staff, he was able to make the changes to the instant messaging interface by updating it with a more user-friendly directory that resulted in a 71% increase in positive feedback, which is a win for the project that has just begun under 4 weeks. It's a good practice to document your project findings in a readable format and reflect on it in yours or your organization's learning log. Discuss your results, summarize, and make 1 or 2 concluding statements and recommendations for future audit or QIP. Present your work to your organization. Remember to tailor your presentation to suit your audience. The staff has done really well with this project, and if they can, so can everyone and anyone by simply applying these simple quality improvement principles and methods. For further reading, please use the link below to download my ebook, Everybody Can Do Quality Improvement, a QI handbook for healthcare providers, written by Dr. Ngozi Ogu and Dr. Babatunde Kukoyi. Best wishes with your project. See you soon. Bye.